Hi, I'm your host, Marsha Florence, for Just As Podcast Live. Thank you, ladies and gentlemen, for tuning in for our Thursday afternoon special of resources and information. Today, we have with us the director of World Medical Relief herself, okay, Josephine Jabara. Now, Ms. Jabara is going to fill us in, ladies and gentlemen, on some very helpful and resourceful information that you may not know about or know little information of. But I'm glad to have her join us. So without further ado, Josephine Jabara, Director of Development and Community Affairs of World Medical Relief. Good morning or afternoon, should I say.
Good afternoon, Marcia. How are you?
I'm good, good. Thank you for joining us today.
My pleasure, my pleasure. I'm very excited to talk about World Medical Relief.
Yeah, now, you know what, Josephine, I have to start off with, what is World Medical Relief? Because a lot of people may not know it. Okay, and there's another agency similar to you. So fill us in on your role and what is World Medical Relief?
Yeah, World Medical Relief was an agency started in 1953 in Detroit by a Detroit woman named Irene Oblin. Initially, it was an international organization, but in 1966, United Way, which was United Foundations at the time, asked her to start a local program for poor seniors. And so she launched a prescription program in 1966, probably the oldest prescription program of its kind in the country. And we still have it, but now it's the Affordable Prescription Program for people 18 years and older. And it is based on income. For instance, if you earn 36,000 or less per year, if you're single, you will qualify. So that's a pretty generous guideline. And it's a very easy program to enroll. It just takes one phone call and we send you the application form. And we provide generic medication. So it's perfect for people with chronic illness like high blood pressure or cholesterol issues. But since recently, we can also supply a more consistent supply of insulin.
Okay.
Yeah.
Now, let me ask you this. So a lot of times, because to me, you sound like a hidden jewel, a service that people like, I didn't know this exists. Is this brand new? And you said 1966 that this program was developed. Where are you guys located?
So we used to be in Detroit on Rosa Parks, or like most people know, it's 12th Street and Webb. But now we are in Southfield, just on the other side of 8 Mile. We can see Detroit from here, but we couldn't, we were expanding. We needed more loading docks, so we couldn't find a building in Detroit. So we had to move to Southfield, but it's within walking distance of Detroit, and we still serve Detroit quite a bit. We have a lot of clients in Detroit and the whole of Metro Detroit.
Okay, wonderful. I'm sure the people on 12th and Webb are just, upset that you moved, but we do know that you're still around. That's the key.
Yeah, it was necessary. And actually, Cass Community is now in our old building. So that was a nice transition, and they really needed a space like that. So we're happy. It worked out for both of us. It's good, yes.
Okay. Now, when people can't afford to pay for their medicine, how does Medical World Relief help?
So people have to enroll and send their scripts in. They have to tell us what the doctor has prescribed. They have to send a proof of income with the form. It's only one form and a couple of surveys. And then we can turn it around very quickly. Normally, it's within 3 days that you get your prescriptions mailed to your home.
Okay.
Sometimes people are coming straight from the hospital here. And then, with the COVID, we cannot let them in the building, but they can come to the back of the building and the warehouse man will bring the information inside and we could process it actually the same day if it's needed.
I was
Um,
going to ask how's it going for COVID because somebody's saying, well, the mail is kind of messed up right now. And no offense to the postal service, but it's a slower process right now. The postal people are trying to be extremely careful too. So, would you suggest or recommend to a person to at least have be prepared to wait a few days? Don't wait till the last minute to request assistance in getting your prescriptions help.
Yes, that's a very good point. Although it seems to have gotten a little bit better, but for a while, for sure, the mail was very slow. So don't wait too long with your refill.
Mhm.
Call it in, and and if you need medications, call us as soon as possible. And any client pays $8.30 per script for 30 days.
Wow.
So even if it's insulin that is like $540, you still pay $8.30.
That is great. I know we had a flyer to show. So let's see if we can bring that up and talk about that because that's you guys' phone number on there. So I need to have you give out that phone number as well. So let's talk about this flyer you have here.
Yeah, it kind of gives the guidelines and it tells that you could be underinsured. A lot of people are underinsured now. Less people are uninsured, but then they end up on a health insurance that doesn't have very good benefits. So then you can't afford your medication. You can afford to go to the doctor, but you cannot afford your medication. So come to us. And sometimes even with Medicaid, when people are on Medicaid, there are certain medicines that Medicaid doesn't pay for. Just give us a call. We might have that medication. And we sometimes have very expensive medicine because we are allowed by the state of Michigan to accept good dated, so not expired, sealed medications. So
Great.
it's amazing what we can do for people sometimes.
Now let's so I'll need for you to give out that phone number just in case some of our viewers need to share this information. What's the phone number they should call?
Yes. Yeah, because everyone knows someone who needs their
That's right. That's right.
medicine, right? And we need to help each other, especially in this day and age. So
Mhm,
that is 313
mhm.
866 5333.
One more time.
313 866 5333.
Okay, okay. All right. And someone will definitely pick up that phone and provide a wealth of information, such as yourself, on what services they can get. Now, outside of the insulin, can you tell us some of the other medical resources you guys cover?
Yes, yes. Our local program director actually said to me today, remind people that we have undergarments, that we have all kinds of incontinence supplies, that we have ostomy supplies, that we even if people have had cancer or mastectomies, that we have these special bras. We have durable medical equipment like wheelchairs, shower chairs, crutches, and things like that. And then we have a lot of medical supplies,
Mhm.
wound care. You would be surprised if you have a wound that takes a long time care, how expensive it is to get all your supplies from the regular pharmacy. And on a low income, you cannot afford that.
Now,
So
is
just
that to receive those type of services? Is that income based also?
it's not income based, but like for the medical supplies and for the durable medical, you need a script from your physician, your physical therapist, social worker. Um,
Okay.
that's all you need. And there's there again a small handling fee charged,
Mhm.
but nothing to compare to what it really would cost. It's just to keep us
You
being
know what,
able
Josephine, you don't even have to explain it. I mean,
to.
whoever's watching the show today is knowing that, wow, all this time I've been paying an arm and a leg and I really don't have the money. Now I can contact this service here. Are you guys considered an agency or organization? What do you consider?
Um, I think we are an agency. We're a nonprofit.
Okay.
Yes. Uh-huh. Yeah.
Okay. But somebody can actually know now that they can call and, get some resources. A lot of people, and no offense to, the pharmacists and stuff, they have to sell their merchandise, but sometimes like the incontinence supplies such as Depends, I mean, a bag of 20 will cost you $40 or $50, and you're going to run through those within a week's time or less, and you're trying to save some, and oh no, I don't want to use too many. We should not have to live like that. I mean, if you have an agency or a services that can provide you something at a discount rate or a waiver, this is the time you want to call and inquire and, try to receive the benefits of this.
Exactly. I forgot to tell you something else, that we also have liquid nutrition, because there's veterans and cancer patients who cannot eat and they live on liquid nutrition. That too is a very expensive item. So give us a call. We might have it.
We need that number again. What's that number?
Okay. 313-866-5333.
Okay. And see, just this conversation that we're having alone. I mean, you guys could have came to the studio and did this, but we appreciated you doing it this way by Zoom, especially during this COVID period. But people are at home watching and listening, and they're like, "Man, I'm glad this lady came on today to tell me that, so I can call and and get this medical supplies." Just like you just said about the cancer survivors and the food products they have or need to have, no one ever talks about that. No one. Okay. And so people will go back to eating regular food and make themselves sick again, or they'll starve themselves to death, or close to it and end up back in the hospital. No one ever tells them, you can contact World Medical Relief and see if they offer any assistance. But let me ask you this. How do clients get referred to you guys? Is it hospitals? Is it other agencies? What are some of their connections?
Just what you said, hospitals, physicians, area agency on aging, prescription or hope, a lot of the free clinics, if they can not help their patients, they send them to us. We work with a lot of other agencies.
Okay. And that's good because really, I want to say I'm impressed, and I shouldn't, because I like gathering information and resources for individuals so that we can make it, accessible and easier for them to find what they need in a more calm manner, instead of being frustrated and, oh man, what am I going to do? We don't have to panic when we know where things are located and and who's overseeing them. So you guys are overseeing a lot of wonderful things for individuals. Okay.
Yes.
Do you guys have, let me ask you, do you do hospital beds, porta potties, things of that nature too?
Yes,
Okay.
we do. Yeah, that's all part of the durable medical
Durable medical.
program.
Okay.
Yes.
Okay.
Actually, the the bathroom equipment, we have a mountain of them, so come and get them.
Okay. Okay. Now, what about volunteers? Do you guys take on volunteers?
Yes, we do. And that's, World Medical Relief would not exist without the volunteers right from the get-go, right? In the early days as Mrs. Obelin, there were volunteers.
Mhm.
And we have over 3,000 volunteers every year. And they are in all departments, young, old, from all ethnicities, all religions. Everybody is working together. It's like United Nations in Southfield.
Right. And that's great. That's great. You know what? If people just were able to, right, at this point, come to the door and, like you said, see all the different, cultures working together hand in hand, racism could be eliminated, because it's like, you need the same thing I need. Okay. And we helping each other.
Yeah, it doesn't seem to exist here for sure.
That's good. That's
Yeah,
really good.
that's why it's such a nice place to work, because all these people are just so wonderful and their heart is all in the right place. And we call our volunteers angels of mercy.
Oh, okay. Okay, that's great. So, okay, now what this situation that we're currently in, the crisis that we're currently in, we only can suggest at this point or advise people at this point to call and ask questions to see if they're, eligible to receive the services. But then if they need something, are things still being delivered, or like you said, you go to the back of the building? What are they doing?
Yes, you brought up COVID, and I first want to say to your viewers that we actually have special funding for people who lost their jobs or, are somehow affected by COVID. And we can pay for the medication. They still would have to qualify, within the income guidelines. So don't hesitate, even if it's something quite expensive, just give us a call. We might be able to help. And then with regards to picking up the items like durable medical equipment, medical supplies, and diapers, briefs, bed pads, it's listed on the website, but you call and then you pay your order, and then it will be prepared. And they will tell you when you can pick it up, and the warehouse man will have it, or the local program staff will bring it right to your car.
Okay. So is there a combination of new and used products?
Yeah, like the durable medical is gently used.
Okay. Okay. Because people can actually donate their remaining leftover medical supplies.
They can. And quite often it's kind of a sad story. People lose loved ones. Or sometimes it's after surgery that people didn't use all the medical supplies or not all the medications. And then they come to us and say, can we donate? And again, gently used equipment. The medication has to be sealed, has to be good dated, so not expired, and no narcotics, please. Never any narcotics.
Okay. Okay. But it's just a great concept altogether. It really is. Because, once again, when it comes down to a person needing a wheelchair or a person needing a bed, they can't get to their room. Their rooms are upstairs and they need a bed put into their living room or dining room, and somebody's trying to make a bed for them on a couch, and they hadn't thought about, calling World Medical Relief to see if they have something that they can use. So now after today's show, you're going to call me and let me know how many calls you get. Okay. Okay. I mean, because really, I'm just saying openly that now is the time for individuals to make those calls to, get some support and some of the things that they need. And that insulin program, now your insulin program is not brand new, is it?
Well, we always had insulin, but it was a little bit hit or miss, because we couldn't afford to purchase it. So it was all donated insulin. But now we're getting into a little bit better situation because we can purchase some insulin also on top of the donated, and we have a diabetes coordinator. It's a lovely young lady who will work with people to find perhaps a more sustained supply, consistent supply of insulin, through maybe Medicaid. Sometimes people don't know that they qualify for Medicaid. Sometimes they need to flip their insurance. They got the wrong primary insurance. The prescription programs through the pharmaceutical organizations. She will help guide our clients to a more consistent supply, and she will help with the educational program. We started that real recently, that people can enroll, our clients can be part of that to learn about their illness and to also learn how to better manage it and also get healthier. Mm-hmm. Because there's quite a lot you can do yourself, and that's right now on paper. So you get the paper package by mail. But pretty soon it will also be on the website. And then maybe we can work with you, Marcia, to, have consistent messaging about diabetes to the general public, because it's very expensive, very costly for society. And it's terrible. I sometimes saw people here in the hallway that came to us after they were discharged from the hospitals without their toes. Mm-hmm. They lost their toes because they had not taken their medication. Mm-hmm. And that's just I hope we can help to prevent that and work with all our partner agencies, with our funders, our foundations, and the federal government to help as many people and prevent further disability.
Right. Well, you know what? I mean, you said a wealth of information and very compassionate about your services. And I'm heartfelt because I do know a lot of people who are struggling with diabetes, and some say, "Well, I'll take it later," or "I don't have any more. I'll get some." People going through a change, and I'm like, "Well, before I eat, I'd rather get my medication, but at the same time, I need to eat to make the medication, work actively." And with the combined efforts now, we're dealing with food banks, food pantries and stuff. I mean, you guys are around to help with the medication. So it's almost like you don't really have to suffer, but if a person is not in tuned into what's out there, that's where the lack of resources come in to them because they don't know.
Right. Yes.
Mhm.
Well, you're helping the poor people. Thank you so much.
Well, thank you. Now, you know what? You said something about a website a couple of times, so you got to get out that web. What's the website address?
Okay, so that's simple. That's just www.worldmedicalrelief.org. WORLD medicalrelief.org.
Okay. Is it on that flyer? Because let's see. Let's bring that flyer up again, and maybe we can see it if it's at the bottom. Is it on the bottom of that flyer?
Yeah, and the black box on the bottom.
Okay. All right. Okay. And the hours and everything. Okay. Okay. Well, that help us out. So someone has wrote it down. And ladies and gentlemen, you can always call us at 1-800-323-5336, 1-800-323-5336, and leave us a message. And we will actually refer your message, if it's especially for Ms. Jabara. We will get that message over to her and her staff if you need some assistance. So just in case, someone misses the show or whatever, we always offer the opportunity for them to call us and get the same resource information. Okay. Okay. So now a lot of times, and I shouldn't have to ask you, but I'm going to, are you going to come back and join us again?
Of course.
Okay. Okay.
Anytime they ask me, Marcia.
Well, thank you, because you know what, we need to learn as much as we can out here, especially during this period of COVID, and you guys have to definitely pop in and tell us what's going on new, with World Medical Relief, because are you guys changing every day now? I mean, is things coming through every day or weekly that you increase your awareness?
What you mean, the
Like,
goods that come in here?
yeah, it's more like,
Oh, it's amazing. Oh, it's a 65,000 square feet building and we're filled to there's so much stuff coming in. It's not just from individuals, it's also from hospitals. And so that's why we need so many volunteers, because the volunteers sort all the supplies, because we don't ship anything expired. It's not allowed. So they have to look at the expiration date, and then it's sorted by different categories. It's fascinating. And, we do accept a few volunteers, up to 20 in a day, and people wear masks and gloves and, gowns, depending which area they are. And if you would like a tour, I will give you a tour. Come and visit us.
Love a tour. I would love a tour. But I heard you say the hospitals donate. I didn't even think about the hospitals donating. Wow.
Yes, because they have short dated items that have to come off the shelf. Or, for instance, if you have surgery, there's something called an OR package that is like a package that has all kinds of items in the package.
Mm-hmm.
So if one of those items is expired, they have to throw the whole thing out. So we get that, and we have a special room, and those volunteers are completely specialized in opening these packages. They know exactly what to do. So gauze, for instance, is no longer sterile, but the countries where we ship to, they have nothing. So they would be happy with gauze that is not sterile, because it's better than no gauze at all.
Yeah.
And so it's amazing. That's why we need so many hands, because it's very labor intense. Every item is inspected for quality, for date, and then for the sort of item, and then it's sorted in all these different categories. And I can tell you that we have a very big parking lot, but it can, under normal circumstances, it usually is filled on Saturdays. It's just people come out in droves, and a lot of young people, a lot of students,
Great.
people who have interest in a medical career. We
Mhm.
we meet a lot of future doctors here.
That's wonderful. That is so great. And and I'm familiar with that suture package, so I do know what you mean when you have to break it down, because it may have the little scissors in there, the gauze in there,
Yeah.
some liquid stuff in there, for wet, that's what they call it, wet to dry wound packing care, stuff like that. So
Yeah.
yeah, yeah, I'm familiar with it, but and it's just good to know that nothing has to be wasted, and what does have to be discarded is discarded, and you still have other usable items.
Yes. Yeah. We keep about 1 million pounds out of the landfill every year.
Wow.
And if you put a value on that for the international program,
Mhm.
$30 million last year.
That
Yeah.
is that
And
is
it goes to countries that are really in a difficult situation, like Yemen. Everybody saw this explosion in Lebanon. We shipped several containers to Lebanon right away, really pushed it hard. And so, yeah, and some countries are in a little bit better shape, but they are trying to get to the next level with their healthcare or open up a dialysis clinic or a heart clinic, and they don't have any equipment or supplies. And then they get it from us. And that's all, especially the EKG machines, dialysis machines, and stuff like that, of course, comes from medical facilities.
Mhm. Now, one last question before we wrap up. So, the title itself says World Medical Relief. Are you guys international? Do you have other branches in other states?
No, this is the world headquarters of World Medical Relief, is
That's
right
what I want to
here.
know, right here in good old state of Michigan. Okay. That's
Oh, yeah, it's something to be proud of, really.
great, great. So people from all over the country can contact you guys for assistance, especially when you said Lebanon and other places, they can contact you guys here and things can be shipped out.
Yes, they absolutely. And then for the local programs, it's the affordable prescription is for the state of Michigan. So even if you are in a UP and you need medication, they can call us too.
Okay. 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 Well, Josephine, before we wrap up, can you give out that phone number and the email web address one more time before we wrap up?
Okay. 313-866-5333. And then the website is worldmedicalrelief.org.
Okay. You know what? I'm very honored to meet you today, and really, and you've given us so much information that we're going to make sure that our viewers see this show quite a bit, so that if your parking lot hasn't been filled in a while, it should be filled again soon. And the volunteers, we hope that they will come out in droves and help out, especially the medical students who are studying to be the next generation of nurses and doctors. This would be a definite eye opener and experience to be had.
Thank you very much, Marcia.
All right. Well, Josephine Jabara, I'm going to close, but I want to tell our viewers, ladies and gentlemen, don't hesitate if you have any questions. Please give us a call, 1-800-323-5336, or email me at Marcia at Just Ask Talk Show. And who am I and what do I always say? If you know a person with a disability or if you just have a general question, don't be afraid to ask. Just ask. I'm your host. Thank you.